All right, that's where we say goodbye from the studio and cross back to Peleso, where the 4th of February is World Cancer Day, and Peleso's out at the Bara Taxi Rank along with a lot of other officials that are doing some tests there. So let's just go to her and find out what's being done this morning. Peleso, over to you. Goodbye from me.
And this morning, we're having an M&M. I'm like, the M&M will go on to find out some things
Well, a very good morning to you once again as we are about to wrap up our special broadcast here, focusing on cancer, of course, Sunday being World Cancer Day. So we're here and we're about to wrap up. So let's just talk to the council responsible for taxis, which is SANTACO. I'll have a chat with a gynecologist and a nurse as well, and some of the people who have already tested this morning. Let's say good morning to Ndate Bafana Magagula. He's the Chief Strategic Manager from SANTACO. But Magagula, good morning. Thank you so much for joining us.
Good morning. Thanks for bringing us to your program.
Thank you so much indeed. This is not the first time this initiative comes to the taxi rank. Have you started seeing some results? Maybe your people, your members of SANTACO, are they coming out in large numbers?
Well, the program is giving very good results because it enhances our program called Shokomela, which talks to care in all aspects of life, including health, including road safety, including your social life. So as we are looking forward and supporting the program, we're looking at most our drivers to be healthy, because you cannot have a safer driver if the driver is not healthy. We're also looking at the safe community, because we need a safer community in order to also enhance our business.
All right, so have they been here, your drivers? I've seen them very busy, obviously taking commuters to work and to the different destinations. Have they been here to come and test?
I was the first one, and then I made sure that they are all not scared or afraid of coming to do their test, and then I led them to the state. We've had a few of them coming.
So have you been cleared? Are you okay?
I'm very okay, and I'm very happy, and that's why I'm smiling. So.
All right, no, I see the smile. I noticed the smile. Let's also have a conversation with Sister Maria Maseleni. She works here at Bara, of course, and of course she deals a lot with patients and victims of cancer and so on. So talk to us about the experience, really. How is it to work with people with cancer?
Good morning. I'm not working at Bara. Yes, I'm working for Johannesburg Health District. I'm working at the district office as a district clinical specialist team. So I'm a PhD within the team. So our role is clinical governance, just to see that things are done the way they're supposed to do, like as cervical cancer screening. It's done to women of 30 years and above. So we ensure that at least women are screened at least 3 times in their lifetime. That is at 30, 40 and 50 years. So now that's our role. So we are happy with such initiatives to say, as a department, we cannot do it alone. We need support from other partners.
So are other partners coming on board?
Yes, they are.
Beautiful. Dr. Mpumi Similani is a gynecologist, and we're going to have this beautiful discussion with you. Let's start with pap smear. That's the most uncomfortable thing that a woman has to do. Do you see women coming out in large numbers for their pap smears?
Look, at the moment, we're still sitting at numbers very low for the number of women who are coming for pap smears. And what is even more sad is that there are increasing numbers of women who are dying from cervical cancer, something that is actually preventable. But going back to the pap smear in itself, it's such a simple 5 minutes. So information is important, but also I think from our side as healthcare providers to make the situation and the circumstances a little bit more comfortable. Let's be nice. Let's smile a little. It's an invasive space, it's an invasive procedure in terms of, it's private area. So I think that kind of communication of what exactly happens when you're having a pap smear and just being a bit more friendly, I think.
Because it's the most, very uncomfortable, as I said. But in terms of prevention for cervical cancer, what would you encourage? Because obviously you come across so many cases.
Yeah. Look, prevention is not only better, it's easier, it's cost effective. So when you're looking at those who haven't started having sexual intercourse, vaccinations is quite an important part. Let us vaccinate our children from about the age of when they start their periods, or from about the age of 9-10 years of age. Then you look at things like the pap smear, the routine pap smears. That's a form of prevention, because if you have something going wrong on your cervix, we can treat it before it gets to the stage where it's a cancer. That's a preventative strategy. It is so much cheaper for the patient, for the state, for just, I mean, financially, it's more savvy. So I think those are the two. I'd say it's easy. It's not that bad. Can we just encourage people? The information is there. Ask questions. We need to ask the right questions. It's never too minor or too high level. Ask the questions. Ask your healthcare workers. And there's always room to complain as well if the service that you're finding is not conducive. I think, it's a patient's right. Health is a patient's right. So we should be providing it in a way that actually supports the patient.
Let's also look into the tie between HIV and cervical cancer.
That's a big one. I mean, if you think about it, cervical cancer is, what causes it is an HPV, which is a sexually transmitted virus. But not only that, we find that patients who, for example, are HIV positive and then they end up with an abnormal cervical smear, for example, it aggravates and it grows so much faster. So it becomes important. You can't separate the message of safe sex, dual contraception, where you've got the contraception but also the condomizing. That's a barrier method, because that will prevent the transmission of the STIs. So you cannot separate the two. I often say to people, you can't test somebody for HIV without offering them contraception if it's a female, and without offering them cervical cancer screening. It doesn't make sense. Yeah.
All right. And now we'll have a conversation with Mama. Mama, utestile?
Yes, ngitestile.
Yeah.
Ngitestile, ngikahle, angina nexi. Mina bengicela
utesteleni kahle amabele
ngitestele i-breast cancer. And then sicela ukuthi wonke umuntu ahamba uyotesta, because i-cancer is not for women only. Abo baba bayasaba ukutesta nabo develop i-cancer kubo. Abantwana abancane la sikhona umntana ezele ene-cancer. So besicela ukuthi everybody ahamba yotesta, ama-drivers wethu.
Okay. All right. Thank you so much. Well, there you have it. That's the end of our broadcast live from Bara Taxi Rank. Of course, it looks like the message has